Good afternoon. As you all know, we're about 10 months into this public health crisis, which is the worst in our lifetime. And we recognize this has been incredibly hard on everyone, trying to manage all the precautions that have been encouraged since the beginning. But we would ask that you continue to try and take great precautions over the upcoming holidays. While we recognize the difficulty as you're trying to gather with your family, we all have a responsibility to try to do our part to decrease spread to our family, to our friends, and to our neighbors. So as you look at gathering over the holidays for meals and other things, please try to keep your numbers small. Avoid large gatherings if at all possible. Try to do outdoor things when the weather permits. Adequate social distancing, wearing masks, all the precautions that we have really encouraged from the beginning. We've noticed an increased number of cases since the Thanksgiving holidays, where many of these were social gatherings for families, and our hospitalizations have increased as a result of that. So we just ask that you all make a good faith effort to try and do the best we can to decrease the number of cases across the upstate. As Tammy said, the number of cases has been skyrocketing across the country, and especially true here in the upstate. So thank you for making that effort.
Thank you. With that, we will go with the Bon Secours St. Francis Greenville Chief Clinical Officer, Dr. Marcus Blackstone. Let me go to him. Dr. Blackstone.
Thank you, Tammy. You know, I go back to conversations we've had this summer and fall about bed capacity. And, you know, we're at that point where our hospitals are full, our beds are full. You know, we're turning over beds. As soon as we can get a bed empty, there's already people waiting on it. We're holding people waiting on beds. So today I would really encourage you to really take the responsibility, as Dr. Mock said, of, you know, staying out of big groups, doing the things we've all talked about. And you'll hear my colleagues talk about, you know, after I get done. But it really is straining our capacity to be able to provide the care to patients that we need to provide, COVID and non-COVID. You know, this not only affects our community, but it also affects, you know, our staff who obviously live in our community. And even if we can make available extra beds in our hospitals, it doesn't always mean that, you know, we can staff those beds if we have employees that are out because of COVID. So I would ask you today, unfortunately being, you know, with Greenville County leading the state for quite a while now, not just by a little margin, but by a large margin, and, you know, help us help you and give us and our employees the ability to provide the care you need. So I appreciate your efforts to do that. And, you know, with those efforts, it will allow us to continue to provide the care that we're here to provide. Thanks, Tammy.
Thank you. And now we will go to the Chief Clinical Officer for the Prism Health Upstate. That's Dr. Wendell James. Dr. James.
Thank you, Tammy. I'd like to thank all of my colleagues in the upstate health systems for the chance today to talk as a group, as a community of healthcare providers to the citizens of the upstate. We came to you in the summer and we said that we were at a critical juncture with our bed capacity, and we are well beyond that at this point. We have done many, many things in that period of time since we talked to you last about this to do what we can to increase the capacity of all the systems of the upstate. We have done as much as we can do. We need the partnership of the community to help us steer through this last few months until we can begin wide-scale vaccinations of the public and hopefully get this under control. The COVID-19 vaccines are just now rolling out to the frontline providers that we have to take care of all of the people of the upstate. We're doing as much as we can to get them vaccinated as fast as we can. And we hope we can get that done before the first of the year, at least early in January. There'll be another few months before we can get the at-risk population vaccinated. So we're not quite to the point of being at the end of the tunnel here. We're getting close, but we still need cooperation to protect all of our community members that are high risk for this virus. It'll be several months after that, probably into the late spring, early summer, before we can vaccinate the general population. What does this mean? Why am I saying this? We have a light at the end of the tunnel. We still have a lot of people that are very much at risk of this virus going into the holiday season. We saw a significant rise in the number of COVID patients after Thanksgiving, and we absolutely are dealing with record numbers today. We are dealing with more COVID virus patients in this system, in every system in the upstate, than we saw in the summer. And it is taxing the ability of these systems to provide the care that you need. We need you to help us. So why are we talking to you today? We need you to take precautions during Christmas and New Year's. We hope next year can be a much more normal Christmas. This year, we have to be careful. We need the cooperation of everybody in the community to help us keep you well. What do we need you to do? Practice social distancing. Meticulously wash your hands. Wear a mask, please. I know that a lot of people don't like masks, but they are the single best thing besides hand washing and social distancing that we have to mitigate the spread of this virus. Don't travel or be in large crowds during this period. It's going to be a huge, huge temptation, especially on New Year's Eve, for everybody to get together and watch the ball drop. Try to do it from home this year, please. We need you to help us with this. We hope this vaccine will be very effective, and we're very, very certain, at least I am, that it is. And we will see an end to this need towards the summer. But right now, we have a very, very big problem in the upstate with respect to volume of patients. Do everything you can to stay safe with your relatives over the holidays, especially the elder relatives. Do a video call. Don't collect in a large crowd. We're seeing lots and lots of this spread within the families, and the elders are not doing well with this vaccine, with this virus. Please help us. Have a safe holiday and enjoy it, but do it a little different this year. Take advantage of some technology and try to use the videos as much as you can. Thank you, Tammy.
Okay, thank you, Dr. James. Now we will go to Dr. Matthew Logan. He's the Chief Medical Officer and VP of Medical Affairs at Self Regional.
Thank you, Tammy. You know, at Self Regional, we're in a similar situation to the other hospitals in the upstate of South Carolina. Since Thanksgiving, we have seen our COVID inpatient volumes double, as well as our percent of people testing positive through our testing lines. I personally am an ER physician by trade, and I've seen firsthand some of the regret on the faces of family members who have had no symptoms when they gathered for Thanksgiving, only to later develop symptoms and realize they had exposed their loved ones. One of these patients, for example, is severely sick on the ventilator in our intensive care unit right now. There's a lot of misinformation about COVID on social media, and I assure you that COVID is real. And I hope that our population in the upstate will try to take it real seriously this Christmas break. We don't want to be the people that look back on Christmas 2020 with regret, thinking of what we could have done and help keep our loved ones safe. So be safe. Like my colleagues have said, avoid large gatherings as much as possible. If you are getting together with family, keep it to small groups as much as possible and meet outside as well if possible. Try to maintain 6 feet of distance between you and others not living in your home. Wash your hands, wear a mask around those not living in your home is also key. And don't go to any gathering if you don't feel well. Even if you just feel a little tickle in your throat, it's just not worth it. Be particularly aware of precautions for those over 65, those with diabetes, those with heart and lung disease and other comorbidities. Like Dr. James said, we can get on the other side of this. A vaccine is around the corner. Just hold on a little bit longer, and we think that by this summer, hopefully we will start to see some improvements and maybe a little not as required as much of the mask wearing and whatnot, hopefully in the latter part of 21. So thank you all.
Now we will go to Spartanburg Regional Healthcare System's Chief Medical Officer, Dr. Christopher Lambertozzi. I'm working on that one, Doctor. Hold on.
All right, I hope you can hear me. Thank you, Tammy. It's Lombardozzi, but that's okay. I've heard different themes on that voice, on that name. You've heard from all of our colleagues here today, and I believe this is the first time that all 5 systems have made a joint statement. And I think that speaks to the seriousness of what we're talking about. There's probably no one that hasn't been affected by this pandemic. Clearly, we are all tired, we are all worn out, and in some way, shape, or form, no matter what you do, no matter what your age, no matter where you live, you are affected by this. And I think we'd all like it to go away. We have an opportunity here to do a couple things. One is to get a little bit of control over it before and after the holidays. As everyone has already said, we are seeing higher and higher highs each and every day. I spoke to a group just before Thanksgiving, and at that time, I told them that we had approximately 70 or so inpatients with COVID in our system. And I thought that was extraordinarily high, and I was very concerned with how we were going to be able to manage over the upcoming weeks. And unfortunately, the upcoming weeks occurred pretty much as we predicted, which is to say that the numbers continued to rise. And we have more than doubled the number of patients that are in the hospital with COVID. And we don't see any decline anytime soon. And that's been the case of all the upstate hospitals. That puts an enormous stress on all of us, the doctors, the nurses, all the folks who are taking care of our community. We're doing the best we can, but at some point, we too are human and we need your help. You've heard that message before. We really need your help. We need you to practice distancing. We need you to be smart about the holiday gatherings. It's so hard to ask people to say, just do a Zoom for Christmas or for New Year's, but it's safe. And if we get big families together, if we get lots of friends together that are coming from different places, we know what's going to happen. We know we're going to have more positive cases. We know we're going to have more hospitalizations. And unfortunately, that always leads to more deaths. We're closing in on about 4,500 deaths in South Carolina so far from COVID. And I can tell you that all the folks who are speaking today and speaking for all of the folks that we represent, we really don't want to see any one more. We want this thing to end. So you've heard that vaccines are coming, but you've also heard that that's going to take some time. It's going to be several months before we can get everybody vaccinated and before we can get a better control on transmission and exposure. So we need to take action today. We need to do the things we can do. Wear the masks, practice distancing, be smart over the holiday in terms of getting together with large groups. Please, please, please don't do it. And wash your hands, of course. There are some additional precautions that have been mentioned before. Clearly, if you've got folks who are of older age or who have significant medical problems, you need to be even more careful. Let's buy ourselves some time. Give us a few more months. And I think that we'll be making our way out of this, and that light at the end of the tunnel will become real light. But we are still well in the tunnel, and we need your help. We need the community's help to help get us through that. Thank you.
Thank you. I'm not going to turn my video on, but I'll just let you take the first question that we received. So the first question is that viewers wanted to ask about medications and supplements or other things that doctors are using to treat less severe or more severe COVID cases, kind of like the treatment plan and the things that we're using that are working for patients.
Sure. So unfortunately, there is no cure for COVID. We continue to provide supportive care across the world. A variety of different therapies have been tried, but there's nothing out there that acts as a cure or prevents you from getting COVID other than the things that we are saying, which is try to avoid contact and close contact with other people as much as you can, wear the masks and wash your hands. That's why a vaccine is so important, right? That gives us an opportunity to not get infected in the first place and not transmit it. But the vaccines are not readily available yet. It's still going to take some more time. So there is no cure out there. In case anyone's wondering, there's no magic pill. And that's why doing these preventative measures, being smart, being safe, and biding our time until we can get out of this, that's what's really important.
All right. With that, I'm going to go to Dr. Logan. This is a question about visitation. And I know every hospital is a little different, so he can talk about it from his hospital, and then we'll go from there. So the person is asking about when there is a parent that has a child that's in the hospital or in the ER, are they allowed to usually go with their child if their child is older than 18 is the question. And how does your hospital, how are you addressing visitation for COVID patients or those in the ED?
So in our emergency department, we allow one visitor with the patient at any one time. Unless if the patient is there with COVID symptoms and has COVID, then we don't allow visitors in that situation. We do allow a parent or guardian to be with a pediatric patient in the hospital, as well as the emergency department.
And has a visitation, though, I think all those policies have been working fairly well, Dr. Logan?
Yes, they have. I mean, that's one of the hardest things, honestly, is the restricted visitation. I know people want to be with their family members when they're in the hospital, but at the same time, we actually were looking at reducing or changing our visitation policies kind of in late summer, early fall, and then we started seeing a little resurgence, and then so we decided just to kind of leave it where it is as the fall kind of progressed, and certainly now after Thanksgiving, we're seeing the resurgence. So we decided to just kind of leave our visitation policies in place for now. I think the other upstate hospitals, there's a little difference between each of us. We all have restricted visitation. And we have been fortunate to be able to collaborate on the visitation policies as well across the upstate to make sure we're doing the safest thing for our patients in the hospital.
Okay, the next question, I'll go to Dr. James.
Yes, ma'am.
There you go. So the question is about, we get this question often from the media. They ask about capacity. You know, how close are you to capacity in ICUs? And I know that's different everywhere, but I'll know you could take that in general, Dr. James.
So in general, when you look across the state, we still have ICU capacity. When you look at it by region, and you look at the upstate capacity is significantly tapped. We are all juggling our beds. What do I mean by that? I think Dr. Blackstone spoke to it best. When one person leaves, we're putting another person right back into the bed behind them. So it varies by region in the state, depending on the number of new cases that we're seeing and the rate of rise. The rate of rise in the upstate has been significantly higher than anywhere else in the state for the last several weeks. And it's putting strain on every system in the upstate. That's why we're having this rather unprecedented joint conference today. We need everybody to hear that we need some help, and we need the public to help pick up their part of this and do what we're asking them to do to help mitigate the spread of this, because we are extremely concerned that if we see the rate of rise continue to go up, and I think we have some DHEC charts that we may not be able to present live, but will be available later. When we see the rate of rise is rapid and as high as we're seeing right now, it doesn't take long to totally consume the capacity. And we've said this before, this is a supply and demand type of problem. We can supply beds, but we cannot supply them faster than the demand is going up. And so there will come a point where things tip over, and we don't want that to happen. That's why we're having these conversations today. But across the state, there are beds. The Upstate is probably straining way more than anybody else right now, but we're beginning to see this happen across the whole state. It's just not at the degree we're seeing it in the Upstate.
Good. Thank you, Dr. James. The next question is for Dr. Mock, and I'll go to that. Dr. Mock, the question is related to you have begun wave 1 of employee vaccinations, and you're scheduled to continue them through the rest of the week. Can you provide an update on the vaccination process at AMED? Do you know how long it will be before all 1,000 doses of your vaccine is utilized? And do you have any other details of what will come with wave 2?
Thank you, Tammy. I think you've got Dr. Blackstone pulled up.
Yeah, hold on. Yeah, let me go to you now. There we go. Thank you.
We look very similar, but you know. So yeah, we began vaccinations last Thursday with a few trial to check our process, and began in earnest on Friday. And we're vaccinating somewhere between 150 and 200 of our employees a day, and that's what's going on today. We did get additional vaccine in this morning, so we have continued to open up to more people and send more invites for our employees to come and schedule as we get more vaccine. So we are into wave 2 already.
All right. So the next question, I'm going to go to Dr. Blackstone. All right. So Dr. Blackstone, the question is about how do we think fundamentally, and in particular, why the Upstate is the state's worst hotspot? Not in terms of number of cases, because that can be related to higher population, but in the vast difference in infection rates. And do you have a comment about seeing double the number of COVID patients?
So I'll start with the number of COVID patients. You know, just like Dr. Lombardozzi said, we've doubled since right before Thanksgiving. You know, in COVID patients, it's exactly what we predicted. You know, as far as the Upstate numbers, if you go through Greenville and the surrounding area, and you walk in areas like big box stores, as well as, you know, hearing people have gatherings, it doesn't surprise us why we have the numbers we have in the Upstate. I mean, when you look at Greenville and Spartanburg counties, you know, running higher and neck, I mean, from that standpoint, you know, it's pretty obvious why this has happened. You know, there's a segment of the population who is either just tired of COVID, like we all are, and have just said, you know what, you know, I'm just not going to do this. But unfortunately, what the worrisome part is, we're starting to even see it in the older population who, you know, who aren't following the same guidelines, or not being encouraged to follow the same guidelines, or being included in gatherings where they really shouldn't be because of their high risk. So honestly, we talk about this every week between the 5 of us, and, you know, in our health systems, this doesn't surprise us given what we see in the community.
I was going to see if one of the other physicians wanted to add to that. Let's see. Maybe we'll go back to Dr. Lombardozzi. Hold on, I'll go to him. There you go.
Yep, thanks, Tammy. You know, it's always hard to talk about this, because I think you're sensing the frustration that we all have in healthcare right now. We know what needs to be done. We also know how difficult this is from an individual perspective, right? It's really easy to take the easy path and to not wear a mask, or to not practice social distancing, and say, well, it's just me, it's just my risk. That's true, except that if you get COVID, 1, you could get sick, and 2, if you get COVID, you're going to transmit it to someone else, and that person can get sick. And that's what we're seeing. We need people to do the things that we've asked them to do. We know those things work. when people are actively practicing distancing, when they're actively wearing masks, when they're being smart and being safe, then the numbers go down and we can manage it. But when they don't, then the numbers go up and they'll continue to go up. And the reason we're getting together today is because we are extraordinarily concerned about what's going to happen when the holidays come, where people get together in large groups, and then we're going to have tragedies occurring in January. So that's why we're pleading with you. That's why we're presenting this strong message today. We desperately need people to do the things that we know will work.
Well, I think we've answered all the questions in the chat. So Dr. Lombardi, if you have one other thing that you would like to make sure you add, and then I'll go back to all of the other spokesperson and have them add something also.
Sure. I think one of the things that gets misconstrued when you hear doctors talking about really prescriptions, right? A prescription for health. We're asking people wear masks, practice distancing, don't get together in large groups. Here's what we're not saying. We're not saying you don't want to have normalcy. In fact, we want to get back to normalcy, but we want it to be healthy normalcy. We want businesses to thrive. We want your kids to be able to go back to school in a meaningful way and not have to worry about all the disruption that's occurred today. We want the same things you do as a community. And that's why we're presenting this message today. Thank you.
Thank you. And with that, we'll go to Dr. Matthew Logan. Dr. Logan.
Hey, thank you. Yeah, I totally agree. We all want to get back to a sense of normalcy. You know, just like we've talked about this whole conference, is we really want to be super precautious over the coming several weeks over the Christmas and New Year's holidays. It's so hard. It's such a great time usually for family and friends to get together. But let's just do it a little bit different this year. Again, try to keep it to small groups. If you're around people that don't live in your home with you, you really need to try to continue to social distance and wear masks. Again, around people that aren't in your little home bubble. Those that live in your home, it's fine. But when you're with people that you don't live with you every day, that's where the exposures tend to occur. So be careful. Give us some time. Hang in there just for a little bit longer. If you guys can give another 3 to 6 months, we can get more vaccination out in the public. We can get on the other side of the COVID and get back to normal. And hopefully next year we can have a normal Christmas and New Year's. Thanks.
Thank you. With that, we'll go to Dr. James. Dr. James.
Yes, ma'am. I would like to maybe in closing propose that we will be able to release some of these charts to the public, and I think it would be good for them to look at what we've got, especially the DHEC charts, where it shows the volume of rise that we're seeing in this community. For 5 health systems that cover the entire upstate area to get together like we have done today and talk directly to the community for help, please don't lose the importance of that. This is something that you don't see happen very often. We are all deeply concerned that if we start off the new year with a rise from the point we are at today, that we will have a significantly difficult time managing this. We can do this together, and we have asked this multiple times. I know we're tired of this. I'm tired of it. We're all tired of it. But we are so close to the end of this, let's don't blow it now. We can make this work. If you will distance yourselves, do not travel unnecessarily, wear a mask, wash your hands, and do not collect in large groups outside of your immediate family this Christmas, as much as that's going to be difficult to do. It is in the best interest of the entire community and you, each one of us. We are responsible to the health of our families and ourselves and each other, and we need to take that seriously. I know I've beat on this like a broken record. We have to get together as a community, and we have to do what we can to mitigate the spread of this in a way that we can manage through until mid to early spring. If we do that, we're going to do fine. But we are at extremely high levels of this disease in our hospitals today, and we are pleading with the public to help us manage this. We cannot manage this without your help. It's going to take a team effort on the part of the whole community. And I have faith in this community. I think we can do this. We did it in the summer and we brought these numbers back down very rapidly because I think the public listened. And we just need them to do that now. If they will, we'll be fine. And we can get everybody to the vaccinations and get past this. And maybe summer will be a little bit more like what we would consider normal. But give us some help here. We're begging you. And we need the help. Thank you.
Thank you, Dr. James. We'll go to Dr. Blackstone.
Thank you, Tammy. Just to reiterate, I mean, everybody's talked about the guidelines. I mean, we are truly pleading for your help. But what I'll focus on is we get asked a lot about capacity, in particular ICU capacity. We've already all extended our ability and created beds to increase bed capacity, floor bed capacity, as well as ICU capacity. But as been talked about before, there is a limit, and we are pushed up against that limit now from a standpoint that there's only so far that we can actually expand in all of our facilities and still be able to staff the beds, that we have. So, I agree with everybody. You've heard Dr. James and I here, you've heard you've heard the others in the media. I mean, we literally are begging you to help us as a community to keep us in a position that we can treat patients, because none of us want to get to the point where, patients show up and we don't have anywhere to put anybody. That's not the situation anybody wants to be in. And we're trying and doing everything we can from our standpoint to avoid that. We just need your help. And I agree, for another 3 to 6 months, if you'll just help us. And we saw you do it in the first surge. All the numbers went back down, in May. We were able to go back and start elective surgeries again, get back to some normalcy in the hospitals. So we know you can do it. We're just asking you to do it to help us get over the hump until the vaccine gets widely distributed. Thank you, Tammy.
Thank you. And then we will go to Dr. Mock.
Well, I'll echo, Tammy, the comments of all my colleagues. Everybody's hitting the nail on the head. These are not asymptomatic cases in South Carolina that are going up that you're seeing. These are, what we're talking about are the cases where people are sick enough they require hospitalization, possibly require an ICU stay. And we are all stretched to our capacity. And as Dr. Blackstone said, that is in spite of increasing capacity over the last 6 to 8 months as we saw this thing coming. But we are tight on beds. We are certainly tight on staff, nurses especially, to staff those beds. And all this is something that can be improved if people in the community will change the way they're managing their day-to-day activities. So like the others, I just plead with people to please take precautions and keep your family safe, keep your friends safe. We would just ask that everybody would try to do the best they can over the coming holidays, please.